food is the foundation of life. If you don't have good diet, you can't out supplement that. Using a whole food diet, we can keep our dogs and cats stone free and disease free.
Welcome to Unleash Curiosity by Vital Pet Life.
I'm Dr. Amber De Silva, veterinarian and advocate for integrative pet care.
And I'm Donie Yamamoto, founder and CEO of Vital Pet Life. We're so glad you're here.
This is a space where curiosity, compassion, and science converge, where we explore the powerful mind-body connection that supports your pet's health and your own.
Each week, we'll dive deep into the world of pet wellness, breaking down myths, exploring ingredients, and learning from expert voices across the industry.
From nutrition and sustainability to transparency and advocacy, we're here to help you feel more confident, connected, and informed in your care choices.
Let's get into it, because when we know better, we do better. This is Unleash Curiosity. Welcome back to Vital Pet Life's Unleash Curiosity, where we help you give your pets the longest, healthiest life possible. I'm Donie Yamamoto, and as always, I'm joined by Dr. Amber De Silva. Today, we had a very special guest, someone who has practiced holistic pet care for over 40 years, Dr. Judy Morgan. She's a veterinarian, acupuncturist, chiropractor, food therapist, best-selling author, international speaker, and the owner of Dr. Judy Morgan's Naturally Healthy Pets product line.
Dr. Judy Morgan won dozens of awards, from Woman of the Year in the pet industry to Holistic Veterinarian of the Decade, and has helped thousands of pets live longer, healthier lives. Dr. Judy, welcome to the show.
Thank you very much. I'm happy to be here.
We're so excited to have you. As I mentioned, I've been a fan, and I've been following you for years. Yeah, so I'm fangirling right now.
Don't.
Yeah, and we're excited to have you here because I know whatever it is that we'll uncover in this conversation will really help a lot of pet parents and, people like me, Dr. Amber, on how we can help our pets live longer.
Well, that's the goal.
Yes.
Yeah, and I'm really excited as a fellow vet to talk to you about, how do you practice holistic medicine versus I feel like, I try to talk a lot about nutrition and, stuff like that to my clients, but how does that actually cross into holistic veterinary medicine? So I'm super excited to ask you questions, pick your brain and get to know more.
Yeah.
Awesome.
Dr. Judy, your career is incredible. Over 40 years as an integrative veterinarian, plus awards, books, and even podcasting. So for our listeners who might be new to holistic pet care, could you give us a quick overview of what led you into this path?
My life is a series of fortunate accidents, and I accidentally took a chiropractic course. I didn't know that that's what I was taking. And after I'd been there for a few hours, I was like, I really think this guy's talking about chiropractic. I don't know if I believe in this. But it was an expensive course, and we had paid for it, so I stuck it out. And when I got back to work the next week, I started using what I had learned. And the very first patient I used it on was carried into the office. And after I treated the dog, it got up and ran down the hallway. And I went,
Wow.
that was cool. What else is there to learn? And so that really started me on the journey of looking at all the different modalities that are out there. And eventually I took acupuncture, which was kind of the turning point in my career, because I really, really embrace traditional Chinese veterinary medicine. So using acupuncture, herbal medications, food therapy, which is really my big thing, and Tui Na, which is sort of a combination chiropractic and massage. But once I started putting out there that I was doing all these holistic modalities, I started getting a lot of referrals. Clients would come in and they would teach me things. So one time a client came in and had these raindrop therapy cards that they were using as crystal therapy. And I was just like, whoa, this is way out there. But I listened to every single person who came in and brought me something new and said, okay, well, let me at least look at this. Let me be open-minded. And that is one of the things that we really need to embrace, is being open-minded and willing to explore other things that are out there, because you never know what might really resonate with you. I studied homeopathy for a while, and I I decided that homeopathy wasn't really my thing, and that in order to be good at it, I would have to study that for about 125 years. So I decided Chinese medicine was easier for me to learn.
For Wow. I think that's what we should be at, especially there's so many changes now and like the world's getting smaller. Like we have all this ingredients or like techniques, right, that are being put out there. Like everybody's like sharing. I think 2 days ago I was just looking at this like herbal ball that I saw on Instagram. It's something that I'm also curious about. Like, okay, how can I make it? Like just for massaging, like, So yeah, that's great that you're open and you're ahead of the curve and now you can teach us. Okay, so you've written several books like Yin and Yang, to Nutrition for Dogs, Raising Naturally Healthy Pets, and Keeping Your Pets Naturally Healthy. Which one do you think has made the biggest impact on pet parents so far? I mean, the three titles are
I,
really great.
I've written 9 books. My original, the first one was From Needles to Natural.
Mm,
And that one made the biggest change in my career because once I wrote it, then I found out that people don't just buy a book because you write it, you actually have to promote the book. Huh,
yeah.
imagine that.
Yeah.
So that's really what started my social media, my website, my speaking.
Mm,
So that one had a huge impact on me, but I didn't know very much about marketing books. And so the one that has sold, probably the 2 that have sold the most copies, are the original Yin and Yang Nutrition for Dogs, which is based on TCVM food therapy, and then also Raising Naturally Healthy Pets. So, um, Yin and Yang was very different from other cookbooks because it's actually using food as medicine.
oh,
And for people who wanted to get away from processed food, or people who wanted to be able to treat their dogs, heart conditions, kidney conditions, liver conditions, and didn't want to use a prescription diet that's very expensive and made with
mm,
bad ingredients,
mm,
it was another option for them. And that's why Yin and Yang 2.0 came out, because
mm,
in the original one, not all the recipes were balanced. There was a chapter on how to balance them, but a lot of people never got to that chapter. So they were feeding unbalanced diets. And I said, I better rewrite this and make sure every recipe is balanced so that people don't have to think. All they have to do is put the ingredients together. But Raising Naturally Healthy Pets was written for someone who's new to the holistic pet space. And
mm,
it goes over how to find a holistic veterinarian. And if you can't find a holistic veterinarian, how do you have conversations with your traditional veterinarian without getting into arguments and without making them feel like they're being challenged?
yeah.
And sort of how to navigate that space. Also has a ton of information on vaccinations. How long do
Mm-hmm.
they last? Who needs them? Why would you get them? Why would you not get them? What are the possible side effects for each one? So just a ton of kind of the basic information. And then sort of the sequel to that is Keeping Your Pets Naturally Healthy. So if you're getting more into the holistic pet space and you're like, okay, well, my dog has liver disease, but I don't want to use all these medications. What could I use instead? And that's what that book goes into. So each chapter covers a different organ system in the body: respiratory diseases, digestive diseases, allergies, arthritis, and how would I treat them from a conventional standpoint versus a natural standpoint. So
Yeah.
we kind of walk people through all different levels.
So it looks like those three books pretty much is should be in your like home. Like I feel like now you're just talking about yin and yang. I want to get that because like my 13-year-old dog has he had bladder issues, but we were able to take it out, the stones. But again,
Mm,
we're in prescription diet, and as
sure.
he gets older, like I also have that kind of thought, like is it healthier? Like when it comes from a can, like I pretty
Right.
much wanted to give him the other support, which is
Yeah,
organic and whole foods.
exactly. And we're always going to do better for our pets. Food is the foundation of life. If you don't have good diet, you can't out supplement that.
Exactly.
So using a whole food diet, and there are different recipes depending on what kind of stones they are. So that's
Mhm,
important to know as well.
mhm.
Um, and so we kind of walk through those different things as well. But we can keep our dogs and cats stone free and disease free. We've had a lot of dogs going into heart failure using my heart draining diet to get the
Yes.
fluid out,
Uh-huh.
that it'll reverse them and take them back into, we want to take something that has been a chronic disease that's stable. If it
Mhm.
suddenly becomes an acute problem, how do we dial it back? to
Yeah.
chronic.
Mm,
And so food is really, really
mm,
good for that.
that's good to know. Yeah, I'm excited. I'm gonna get that book after.
Well, then you're going to be really happy because anyone listening to the podcast, if you use the code VitalPet50, you can get 50% off of any of my books on our website.
Hey,
Oh,
amazing. Thank
yay.
you.
So everybody
I
fill up
want to
your
buy those
library.
Yeah. Yeah, there's 3 books something that you
too.
need to have. Yeah.
Yeah. Dr. Judy, you often talk about 6 ways to keep pets naturally healthy. So, can you walk us and our listeners through them?
So number one, food. We've got
Mhm,
to get good food in the bowl. So that means using fresh food and whether you're buying it already commercially made or making it yourself. And if you're making it yourself, that's fine, but we need to make sure that we're getting all the nutrients in the bowl. And that's where our recipes come in. And on our website, we have tons of free recipes that you can download. And we also have a list of the foods that I'm willing to feed my pets. It's not
mhm,
a very long list because I, have local companies that I like. Susan Thixton at truthaboutpetfood.com has a bigger list that she spends a lot of time putting together each year. So truthaboutpetfood.com is a wonderful resource. She also keeps you up to date on recalls and,
mhm.
problems in the pet food industry. So the first thing is let's get good food in the bowl so that we have a good foundation. Second, we want to minimize vaccines. I'm not an anti vaxxer. I've been called that, but I'm not. I'm a responsible vaxxer. So if you're going to give vaccines, you need to know how long they last and how often they need to be given. We
Mhm.
don't need to vaccinate our pets with core vaccines every single year. That is crazy. We're just causing autoimmune problems and immune system dysfunction. So it's really important to educate yourself on what is your pet's lifestyle and what vaccines would be, it might be important for your particular pet, depending on what they're doing. Do they go to boarding, grooming, daycare,
Mm,
where there's a laundry list
school.
of things that they require? Or are your dogs like mine? They're home on the farm in their own fenced backyard, very safe, and they don't come in contact with anybody. So you need to look at that. So we want to, find the minimum that we need to keep our specific pet healthy, not go with a one size fits all.
Yeah.
Um, we also want to minimize chemicals and medications. So we're not looking to put our pets on medications that they're going to stay on for a lifetime. Medications and even prescription diets are meant to be used for very short windows of time to get over the hump. And this is where I really like the holistic part of my career.
Mhm.
For instance, one of my cats got sick a few weeks ago. She was head pressing into her bowl. Her blood work showed a
Oh.
really high white cell count, a lot of allergy cells. So she's got something going on in her brain that is causing brain inflammation.
Mhm.
And it looks like it's an autoimmune problem. Totally indoor cat. Don't know where it came from. And
Mm,
I said, okay, well, this cat needs some steroids right now. I've got to take down the swelling in her brain and make her feel better. In the
mhm,
meantime, while the steroids are doing their thing, I'm going to start her on supplements that
mhm.
are natural, that are going to help her immune system calm down, flatten everything out, and get her back to normal. So
Yeah.
she only had to take the steroids for a very, very short period of time. Now,
Mhm.
in traditional medicine, I had a
No.
dog who had brain inflammation 40 years ago, and the neurologist put him on high doses of steroids for over a year. My
Wow.
cat got
Whoa.
high dose of steroids for a week, and my poor dog, he developed fungal infections, and
Mm,
he lost all his muscle mass. It was awful. So we want to use those traditional medications for the shortest window that we need them while we are helping the body to heal. And that is really our goal in holistic medicine, is helping the whole body put itself back together.
together.
So we're using medications and that stuff at a minimum. Definitely want to avoid chemical pesticides. I mean,
Mhm.
they're just so dangerous. They're neurotoxins and there's no antidote for them. And if your pet has seizures or a problem, you may be stuck with that for life, and then they're on anti-seizure medications. We have so many natural ways that we can prevent flea and tick and parasite problems. I have a book on that as well. So we want to be looking at those sorts of things. It's also really critical that your pet has mental stimulation and regular exercise. So make sure they're getting outside, that their feet are actually touching the ground, that they're getting their sunlight, that they're getting that mental stimulation that they need, because that is really, really critical. Grooming them is not to make them look pretty. Grooming them is to check for lumps, bumps, cuts, scrapes, look in their mouth, look at their teeth. Do we need to be doing something there? Dental care. And I think we have a question on that later, but dental care is really critical. So don't
Yeah.
overlook that.
Yeah.
And look at what you're using in your household. Are you using all kinds of toxic fragrances? Do you have
Uh-huh.
furniture that's off gassing? Are you using Teflon coated pans that
Mm-hmm.
you're burning things in that are emitting VOCs that are toxic to our pets? When we look at studies on toxic chemicals in our household environment,
I
our
see.
dogs concentrate them about 10 times what people do, and cats concentrate
Oh,
them
wow.
about 27 times what we
Wow.
do.
Wow.
So any toxic chemical, like if something is bothering your sense of smell, your little 6 million scent receptors, your dog's got 200 million. So if it's a
Wow.
little bit annoying to
Wow.
you, believe me, it is a lot annoying to them. And I
Mm.
actually had a couple of patients that developed nasal and sinus cancers
Oh.
because their moms wore very, very heavy perfumes to cover up the
Mhm.
cigarette smoke. So
So it's
that
a
was
double whammy.
too many double
No.
whammies going
Yep.
on there.
Yep.
And so, really think about those things in the daily life of your pets.
Yeah, I mean, we have this discussion like in one of our episodes we're in like when I didn't know anything about like I love having like coming home to my place like smelling like a hotel and all those stuff. So now it's like all scrap. No
We get to smell vinegar instead.
Yeah.
Or lemon's a really good one, so I don't mind that one. But yeah, I use all essential
lemon.
we have essential oil cleaning products on our website, and that's the only thing that I use in my house, although I just hired some cleaning people to start helping me out at home, and I came home and I'm like, "This doesn't smell like what I use. I gotta talk to her."
Oh, yeah.
Yeah. You have to tell them which one to use because I
Yes,
do
like,
that
"Please use
too.
this one."
I freak out when like, what else is running low? Like, make sure it's all lemon. Like, yeah.
Yeah, exactly.
Yeah. But I don't mind because I want to have like more time with my guys.
Uh-huh.
Yeah.
Just speaking on fragrance, so I have a 16-year-old son, and when he was a baby, he had this horrible skin rash and like almost, bleeding around his mouth. His skin was so dry and flaky. And so at that time, our pediatrician had told us, like, it's probably something he's reacting to in the environment. We don't know what it is. We went gluten free, dairy free. We cut out all fragrances. We went free and clear on everything. Honestly, I never really found out what did it. It cleared up after that, but that was kind of the point at which we cut out fragrances in our house. And now I notice like I can't even walk down the grocery store aisle that has, especially the laundry aisle and
Yeah.
like, the like Febreze and Glade. Like I don't know if I can say that on the podcast, but like I get a headache now with any of
Yep,
that stuff. And I think, for a long time I was probably sensitive to it, and it just like I didn't realize it because it was always in my environment. So when I finally got it out, now I realize, oh my gosh, I was getting headaches. And
yep,
anyway, I think we don't realize how toxic that stuff is when it's around us all the time and our body just kind of adapts to it.
exactly.
Exactly. Okay. The next question that I have for you, Dr. Judy, is a little bit controversial, but I see it as being in a pet space. Like, I always have that, it's not conspiracy, but I'm just like curious. And I always ask Dr. Amber this question. You've always been outspoken about how big pharma, big pet food influences our vet space or veterinary medicine. Can you explain how this impacts what can vets learn and give advice to pet parents like me?
So there's huge influence, and I've actually been asked to speak on this at a national convention this year. And so when we look at in the human space, pharma has huge influence.
Mm-hmm.
So we think that when we read a journal article talking about a new product or a new therapy and how wonderful it is, we think it's peer reviewed. And so we think it is the gospel truth. What we don't realize is that the pharmaceutical companies
Yeah.
pay
Mm-hmm.
someone to write those articles. And a lot of times when they do studies on new products that they want to bring out, they will bury any thing that doesn't match what they want it to say.
Hmm. Mm,
It's very one-sided on what gets published. And
yeah.
so there's one chemical pesticide on the market that I really just don't like. And in the product insert, it says 217 dogs were tested to, decide if this was safe. I'm like, 217 dogs. That's
It's a lot.
that's just not very many dogs. And some of the dogs in the study died partway through, and they couldn't really figure out why or whether it was related to the chemical. So they just took those out of the study. It
Oh,
actually says
no.
that in the product insert. And I'm like, so you couldn't figure out why they died. And by the way, a lot of dogs are dying from this product and you can't figure out why, but it's okay because you just deleted that from what you submitted to FDA for approval.
Oh,
So
so bad.
unfortunately, the drug reps come in and look, we have the newest, greatest thing. This is better than sliced bread. It's going to cure all of your patients. They're all going to be able to get up and run and be happy and healthy and no side effects. And I challenge every single veterinarian and every single pet owner. If your veterinarian is coming to you and saying, here's pills to give your pet, here's
Mm-hmm.
something to apply on your pet, here's an
Mm-hmm.
injection I want to give your pet, the first thing you need to say is,
Why?
what are the potential side effects? And if
Mm-hmm.
they can't tell you, you need to get out your little tiny computer that you carry in your pocket and you need to put in the search engine, what are the side effects of XYZ so that you know.
Yeah,
Being informed is being empowered.
exactly.
So that's part of the influence. The other thing is almost all of the continuing education once veterinarians graduate, and actually a lot of the education that's done in the veterinary schools is paid for and sponsored by pet food and pharmaceutical companies. So, one of the newer, and it's actually a fresh food company, so yay, but still not one I'd use, but they have now sponsored chairs and endowments and research at some of the university veterinary schools. Okay,
Mm-hmm.
that's great. But in return for that, you are expecting them to talk about your food and how wonderful it is and why it's better than other food.
Mm-hmm.
When I was in vet school with the dinosaurs a million years ago, the end of our junior year, I was at University of Illinois. Upjohn Pharmaceutical Company, which doesn't exist anymore, it's been bought out many times over, but they were in Kalamazoo, Michigan. So our entire senior class jumped in our cars, drove to Kalamazoo, Michigan for a full paid weekend, wined and dined us, and gave us tours of the pharmaceutical company, which was really cool to actually see how things are manufactured and what's done. And then the expectation was when we graduated, every time they had very, very distinctive red, half white boxes for all of their
Mm-hmm.
products. And I will tell you, my first 5 years out of school, when I needed to turn to the antibiotic shelf and look for what I was going to treat a patient with, oh, there were those red, white boxes. And I always grabbed them first because they took me out to dinner and dine me for a weekend. And it's not outright here, let me pay you to use my product, but there's a lot of subtle messaging. And
Yeah.
when you go to the veterinary conferences, so we put on a big conference every 2 years. And so we just got pricing for wrapping posts and putting window clings on for advertisements. And we said, oh, this will be great. Our vendors, if they want to, they can buy a post or they can buy a window. A post is about $25,000 to wrap. I
Wow.
walked into a veterinary conference a few weeks ago, and in the entry hall, there's a long line of posts, probably 20 posts. Every single one of them had the same advertisement from one company for a flea
Oh,
and tick
wow.
product. And I said, they
Mm-hmm.
just spent $1 million wrapping posts. Like that is a lot of influence. There's
Wow.
no way you can avoid seeing it. So
Mm-hmm.
they are spending, that tells you how much money they're making because they're
Yeah.
spending that much money to influence the veterinarians. So there's a lot of influence out there.
I know, but I think I'm really hopeful that we're also a pet company, like we're small, but I think me being an owner, I would really want to challenge, and I hope, like, the other pet owners out there, like, to work with vets in a way wherein, like, try it out. Maybe you can help us, like, be collaborative, right? Like, now I'm talking to you and I'm like, okay, that'll be great. Like, maybe I can share my product with Dr. Judy and then you can, like, tell us if it's good or not, or if there's something. Get what I mean? Like, it has to be, like, more like,
Yeah, I mean,
yeah.
we do want collaborative, and we also want a little bit more open-minded. But
Yeah.
what I really want from the drug companies, and so drug companies and supplement companies are very different, because supplement
Uh-huh.
companies were mostly really trying to help out the pets from a more natural standpoint,
Yeah.
99% of the time. The drug companies are trying to hide the side effects so that
Yeah.
they can make more money.
More money. Yeah.
And not that supplement companies want to make money. I mean, let's face it, that the bottom line is we're all trying to survive and support ourselves and support our employees, but we're also really trying to help the animals. And for these pharmaceutical companies, I can tell you that the money is more important than the health.
Yeah, I know. I kind of get that. Like,
So it's actually only about 30% overall,
oh,
but
that's
for
good.
the specialty and emergency clinics,
Yeah.
70% of them are owned by one corporation, and it is
Wow.
not a veterinary corporation.
I just wanted to mention, like going back to what you said about vet school, is I remember my one semester of nutrition in vet school, and the book was published by the big pet food company. I remember like, if it has kidney disease, feed this food. And if there's liver disease, feed this food. That was so drilled into my brain. I don't
Yep,
really feel like we learned much nutrition. Was, this food, this prescription diet will treat this
right.
disease.
Yep, there was
So,
no
but
talk of, "Here's a homemade recipe if a client
Mhm.
wants to make something. Here's how
Yeah.
to balance a homemade recipe
Yeah.
if you want to prescribe something for your client." That
yeah,
never comes up in conversation, and veterinarians graduate not having a clue how to make
Mhm.
a balanced diet for any species, which is
right.
not the same in Europe. So I had a house call veterinarian when I first moved to North Carolina, didn't have a license, had a house call veterinarian come for euthanasia for my mother's 17-year-old dog. And so while we were waiting for the dog to get snoozy, we were talking, and she had graduated, I think, in the Czech Republic.
Mm.
And so I handed her my books and said, "This is who I am, and here, have some books." And, one of them was the Yin and Yang Nutrition. And I said, "I'm one of those weird veterinarians who really likes to use whole food, homemade diets." And she said, "Oh, well, at my vet school, we had to be able to make balanced diets for every single species."
Wow.
And so she
Wow.
worked for a dairy nutrition company for a while, and then a poultry nutrition company for a while. So she didn't think it was odd at all. She's like, "You mean all veterinarians don't do this?" And I'm like, "No, they don't do this." They have no
Like,
clue.
nope. Yeah, I mean, and I think it's on one hand it was like, "Oh, okay, I can treat these diseases with nutrition." That's kind of what it got into my brain, but at the same time it didn't give me the tools to do that.
Right.
So last year or the year before when I got certified as like in canine and feline nutrition and I was making like using that spreadsheet to make all these balanced diets, I realize how difficult it can be for someone who doesn't know what they're doing. So I
Yep.
think it's, important to have the right tools to make a good diet because a lot of people that home make diets, they don't really know what they're doing. Like you can't just feed chicken and rice with,
Yeah.
frozen vegetables in it and throw in a couple of multivitamins. Like that's not a balanced diet. So
Right.
yeah, it's
Yeah, and I
it's
think
more
that's
difficult, but
That's why
you can do it.
veterinarians are so against homemade diets,
Yeah.
because even if you hand somebody, here's your recipe, make sure you follow the directions. I couldn't find the liver at the grocery store this week, so I just left it out. Or I don't really like handling that slimy stuff. No, I'm not going to do that. And I found that even with my clients in my practice, like one woman came in and she had been feeding her dog hamburger and peas as its only thing that it ate for like 3 years. And the dog
Oh,
Wow.
was still running
wow.
around looking halfway decent, and his lab work wasn't so bad, and I was like, "Okay, he's surviving, but I'm really worried about this."
Mhm.
And so I said, "I need you to just add a couple of things. Like here's a couple, vitamin mineral supplements if you add these." And then I said, "Could you just add some liver?" I gave her a couple things to add. She
Mhm.
came back in a few weeks and she's like, "That was so slimy. I'm never doing that again." And I was
No.
so I get it. I get why veterinarians
Yeah,
are, so against it, because they call it recipe drift. People just drift away from what they need to be
yeah.
doing. And it is, not that every single meal needs to be balanced, but we need to
Mhm.
do our best. Like I ran out of food this week. So last night my dogs had eggs, sardines, homemade yogurt from my dairy cow's milk, and I had a greens, freeze dried greens supplement that I rehydrated. And that was dinner. And I'm like, you know what? If I put
Yeah.
this in my food calculator, this is actually going to come out pretty darn close to being everything that you need, but it's
Yeah.
not totally there. And I'm not going to feed that every single day. It was like,
Right. Right.
yeah, special treat tonight, kids.
For sure.
think I think knowing also like I think having your own like not intuition but at the same time like judgment like
Mhm.
if you think about even with yourself like should I eat this like frozen food every day like get what I mean so it's just a balance and you
Yeah.
need to really like be proactive me I'm very like that's one thing that I we started this business and at the same time like having this like podcast because I really wanted pet parents to empower because like I'm one of those that is always questioning like
Yeah.
where can I find best food for my dogs? I remember before I even started a company, like the only like before I buy the dog food, like I go to those like calculator that you can look online. And there, I forgot the name of the guy that he basically determines like how many percent is accrued, like, and the first thing that I really learned, and I think Dr. Amber also like validated me was to make sure that the first ingredient is protein. Yeah. So that was interesting to me.
Dr. Judy, many pet parents don't realize that dental disease can affect their pet's lifespan. Can you explain why dental care is so important and what natural approaches you recommend?
Dental care is pretty critical. When we have these nasty infected mouths with loose teeth, first of all, they're painful. I don't
Uh-huh.
I don't know about anybody else, but I've had cracked teeth and problem.
Right?
Oh my gosh, talk about
Right.
painful,
Yeah. Me
terrible.
too.
And meanwhile, our dogs and cats are walking around with teeth that are wobbling and they have pus coming out around the roots of the teeth. And it's like, oh my God, that's got to hurt like heck.
Mm-hmm.
So one, it's pain, but two, and pain is actually a huge stressor and a stressor on the immune system. So we don't want that. We want everybody to be kumbaya. And the other thing is the infection in the mouth. The mouth is highly, highly vascular. So all the blood flow is running through the mouth and picking up all those bacteria. And where does it like to land? It gets filtered by the liver and kidneys, but it also has to pass by the heart valves.
Yeah.
So when we have all those bacteria, we're just begging for them to go land somewhere else in the body and cause all kinds of trouble. So we want to keep the mouth as clean as possible. And one of the things that I think is just a huge fallacy and should not be promoted is these non anesthetic dental cleanings.
Mm,
Yes, it makes the teeth look better. You have a nice, pretty smile, but we're not seeing what's going on under the gum line. And
yeah.
75% of dental disease is under the gum line. So I
Mm-hmm.
remember we had a dog that came in for a dental and we cleaned up the teeth and they looked beautiful. And then we took the dental x rays at the end of the procedure to make sure that everything looked okay. And we found that one of the teeth was broken. A
Oh.
root was broken off, and we couldn't see that from up above. And the tooth was
Mm-hmm.
beautiful after we polished it and cleaned it. But we're like, oh my gosh, that's got to be painful every time that dog bites down on that
Yeah.
broken root. So obviously the tooth had to go. But we never would have known that without those x rays. And I've
Mm-hmm.
had so many patients that have come in that they've been getting their teeth scraped off by the groomer, or a lot of veterinarians do it. And they look pretty, but then we get them under anesthesia and we take x rays, and it's like, oh my gosh, we have 7 broken teeth. We have reabsorbed roots. We have all these issues that are going on. So it's really critical that we have a true dental exam done at least once a year, maybe more when they're a little bit older. I know nobody likes putting their animals under anesthesia, and I kind of cringe every time mine have to go
Mm-hmm.
under, especially my ones with heart disease and everything else. But if their teeth are bad and painful, I'm going to do it. It has to be done.
Yeah.
So,
Yeah.
from a standpoint at home, the gold standard is always going to be brushing, just like it is with us. What does your dentist tell you to
Uh-huh.
do? Brush your teeth twice a day, every day, and floss. Well, we don't do that for our pets. I mean, some people go, oh, I have the groomer brush them when they go for grooming. Oh, every 6 weeks. That's great. Why don't you brush your teeth every 6 weeks? You'll feel great. See what your mouth tastes like.
Yeah.
And, there's also the fallacy that dry kibble keeps the teeth clean. It doesn't. It makes the
Yeah,
teeth dirtier. That's
true.
carbohydrates that break down to sugars and coat the teeth. That's like your dentist telling you to eat rich crackers every day and your teeth will be just fine. It's not going to work. So, brushing is really the gold standard. And what I like to use is kind of what we call our DIY toothpaste. So, coconut oil is
Mhm.
really great antibacterial for the mouth. A lot of humans do coconut pulling where you pull the
Yeah.
oil pulling through your teeth. I tried it. The texture just bugs me, but it is great. So using just coconut oil on a toothbrush is really good, or a finger brush. If you combine that with another dental product, whether it's a dental probiotic or another cleanser combined with the coconut oil, you get double the effect. So that's even better. Be very careful with a lot of the dental products. Actually have a blog on my website that talks about ingredients to avoid in dental
Mhm.
products because there's a lot of bad stuff out there.
Yeah.
We don't want chlorhexidine that is ruining the oral microbiome, so
Oh.
avoid that stuff like the plague.
Mm.
So and that goes for shampoos as well. So brushing is great. There are a lot of oral probiotics on the market now that I think are very, very helpful. And
Mhm.
there are a lot of powders that you can put in your pet's food that help kind of realign the oral microbiome. And a lot of them contain seaweed. Seaweed is
Mm.
great for keeping tartar from building up.
Yeah.
So we have a whole
It's
page
like
on dental stuff where you can read a lot of information about that. We also have a new download, and maybe in a blog as well, about how to detox your pets before and after if they have to go in for that anesthetic dental
mm.
cleaning. I have a young dog who, from a Chinese medicine standpoint, was born with a Jing deficiency, which means he has hydrocephalus, water on the brain. He has very poor enamel on his teeth. His
Oh.
joints bend the wrong way. His hearing is all messed up. He's a
Oh.
mess. But because he is Jing deficient and he has poor enamel, which we see in a lot of the small breeds, he had
Yeah.
his first anesthetic dental cleaning at a year and a half old. And if he doesn't get
Wow.
them every year, he's going to lose every tooth in his head. And
Poor
so far, he's almost 5, and we've lost, I think, 2 little tiny teeth. But that's by really being proactive and staying on top of what's going on. And he also is a breed that's prone to heart disease. So, kind of trying to prevent these things.
Yeah, yeah, for sure. I always tell people too when I'm talking about dental disease, like if you don't do anything about it, there's no way to make it better.
Yeah.
It's not that you can just give a medication and suddenly the teeth are going to be okay and they're going to be able to avoid anesthesia or a dental cleaning. Like it's something it's only going to get worse if you don't address it. And then
Right.
um I'm sure, Dr. Judy, you've seen, just like I've seen, a lot of those older dogs who have horrendous mouths and they have heart murmurs. And it's just like, it's just this vicious cycle. And you
Yeah,
have to do something about it.
you
It
do.
just doesn't get better any other way.
It
Yeah.
doesn't. And I'm a huge fan of raw meaty bones. So for our raw feeders, and if you don't know how to feed raw meaty bones, make sure you learn before you start pitching them out to your dogs so that you don't end up with choking hazards and everything
Yeah.
else going on, or feed the wrong size of bone to
Mhm.
the size of your dog. Like there's actually a lot that goes into it. We have a course on Dr. Judy U on how to introduce and feed raw meaty bones. It's not done by me. It's done, that might be a Nick Thompson course, another veterinarian. But it is a way that we can help naturally keep their teeth cleaner. But again, we've got to be careful that we don't have dogs who are such, voracious chewers that they're
Yeah.
breaking teeth, or that we're feeding
Hmm.
bones that are too big, and never, ever, ever feed a cooked bone because they will splinter.
Yeah. Oh my gosh. A lot of things to think about. I'm like the pet parent here that I'm like, ooh, okay, what are the stuff that I shouldn't give the guys? Yeah, dental thing is really like, cause I experienced having a dental issue, and Tuxedo had it, like, and it was so bad. It was bleeding, and it took us, like, again, like, I have to fight with the whole, like, system of getting him a schedule. And finally we got it. And, lo and behold, like, we have to took out like two tooth out.
Yeah.
Yeah. So,
Yeah. Yeah. When I worked with Monkey's House Senior Dog Hospice and Sanctuary in New Jersey. I'm still their chief veterinarian, but I don't practice anymore. So she has to go to other people, but I'm still in charge of what happens. But every dog that comes in there is a senior dog
hmm
from a high kill shelter that has a terminal diagnosis. So they're all coming in with cancer, kidney failure, liver failure, dental disease, heart failure,
Oh,
whatever. And most
yeah.
of most of them have 4 or 5 things going on, and most of them are teenagers. But one of the first things that we would always end up doing, so we'd get them as stabilized as possible, and then they would come in and they would have to get a dental cleaning because they all had rotten mouths. And it is amazing, and people get so afraid. Like, my dog has all these comorbidities. My dog's got heart disease. My dog's kidneys aren't great. And I'm like, well, then we need to tailor the anesthetic protocol to
Right.
match what we have going on with that particular animal so that we can. And I'm going to knock on wood. I never lost a monkey's house dog under anesthesia getting a dental procedure done. But we just felt that it was so critical for their comfort and for
Mm-hmm.
their overall health. And
Yeah.
there are so many dogs and cats that just have rotten mouths, and you bring them in and you clean up those mouths, and maybe they go home with no teeth left, but they feel so much better.
Oh, that's what
So
They
I
feel
much better.
so much
for
better.
sure, yeah.
Yeah.
Because like that's what happened to tuxedos. But yeah, I really noticed that because it took us a long time to get a schedule, and so it was like but luckily I found like really good like vets in there. Like I always like Google and always like eh, questions them, and if I feel comfortable and I feel like they're also like me, that is not 100% on conventional but also is open to holistic, because some of them are really like open to holistic like health and how to take care of the animal, and they're very open. That's where I stick in that like bad build. But yeah, I mean, tuxedo, like he felt so good. Like imagine like half a year of like having bloody gums, and I'm like, oh my god, like we're really trying our best to like help him, and I still can't find like a schedule for the dental cleaning. And finally when we had it done, it two tooth was taken out, and it changed him. Like I
Yeah.
felt like he was so happy. So he was miserable for 6 months and I felt so
Yeah.
bad. Yeah.
Yep.
Yeah.
Yeah.
And I tell my clients too that I feel like most of the time dental disease it's slowly progressive that you don't realize how bad they're feeling until they feel really, really bad. If there's some kind of acute trauma to the mouth, that's different. But in just these ones that get tartar buildup and then gingivitis and
Mhm,
periodontitis, like
mhm.
it's kind of this slow progression. Years ago, when I was a new vet out of school, I saw this lady's cat and I recommended a dental, and she ended up scheduling it with the other doctor in the practice. And that morning when he was going to do the dental, he goes, I don't think the cat's teeth are really that bad, but I guess we can clean them. And then I saw her back like a few weeks later with a different pet. And she said, I am so glad I got that dental done on my cat. He just feels so much better. And
Precious.
that inspired me to go to my dentist too. Uh, just, really validated. Like sometimes it doesn't look as bad as what
Yeah.
you find when you get them under anesthesia and you do a full cleaning and you probe those teeth and look at the x-rays. And so it's so, so important.
Okay,
Yep.
so I have a question. Dr. Judy, like, Banfield have like a yearly dental cleaning. What do you think is the best, like for pet parent? Like, I mean, how many times? Does that to be like yearly for dental cleaning or like?
It really depends on the animal.
Okay.
So for the larger the breed of dog, probably the longer they go in between, the less
Mhm.
tartar they build up. We just find that they have stronger teeth, stronger enamel,
Oh,
and particularly if they're on a species appropriate diet and you're doing everything else more naturally, they tend to do very well. Smaller breeds, like my little Cavalier with all of his issues,
yeah.
he's gonna be there every year, and
No.
frankly, if I was willing to put him under, he probably could do it every 6 to 8 months, but
No.
it kinda and then,
I get scared
like,
every time.
the day after, I know he's gonna have vomiting and diarrhea because he's a chemical-free dog, and he goes in and he
Yeah.
gets all these chemicals, and it screws up his microbiome, and he's just a mess, and it's like, "Okay, well, now we gotta do the whole detox thing."
Yeah.
So it really just depends on the animal. My Cocker Spaniel, so he's 3 times the size of the little Cavalier. His teeth don't get near as nasty as the littler guy. He
Mm,
chews on harder things.
yeah.
It's just you have to look at that individual pet. And what's really interesting with cats is genetics. So my daughter's cat is one of these who genetically has bad teeth. She did the DNA testing on him and it came back with the genes for the lesions the dental lesions. And so, and she knows when he's got an issue because he's painful and he doesn't want to eat. We've
Uh-huh.
actually found a solution to that with a natural product that keeps him from having that pain. But still, even though we can make the pain disappear, we're not making the problem disappear. So every
Mhm.
time he does this, he has to go in, which is pretty much every year. So it just depends on the genetics of your animal, the dental care that they will allow you to do, size, breed. There's just a lot that goes into it.
Yeah, that's good to know.
Yeah, when I had my 70-pound lab mix, he needed a dental every single year. And that was kind of unusual for a large breed
Yeah.
dog. But like, he was just one that built up tartar really fast.
Mm.
Yeah, and it depends if they have any secondary comorbidities. So I find that dogs with kidney disease, their teeth go bad real fast. But that's
Hmm.
because that's
Yeah.
part of the water element in Chinese medicine. And when the kidneys are going, the teeth are going.
Oh, really?
Yeah.
Okay. That's good to know. I'll check these two guys here after. Okay. Many pet parents wonder, how do I know if my pet is thriving on a natural diet, or are there signs to watch for? Like, I think this goes for like probably the, food that you prepare.
So one of the things that you could tell with is one of my little sayings: do they have a patent leather nose and patent leather shoes? So
Hmm.
their nose should be shiny and not
Mm.
dry. If they had a black nose as a puppy, they should have
Mhm.
a black nose as an adult. So go back and look
Mm.
at pictures.
Mm.
Their pads should not be dry and rough. They should be
Mm.
smooth and shiny.
Yeah.
Their coat should have a shine to it. They shouldn't have any dry flakes. And our pets do turn over their hair twice a year because that's just part of
Shedding.
the
Hmm.
cyclical nature, but they shouldn't shed all year long. Like you
Yeah.
should, it's like my horses, my miniature horses for the winter grew about 7 inches of hair. They're crazy looking animals right now.
Wow.
And we will have about 2 weeks in a few weeks here where all that hair will fall out. And the birds are love it because it's like, "Oh, I got all this stuff to put in my nest."
Yes. There's a lot to
But
say.
it literally should come out in like 2 weeks, and then you have this new coat underneath, and it's beautiful. If you have a dog who is shedding all the time, you've got some issues that their diet is maybe not as moisturizing and as
Mhm.
beneficial as what it should be, and
Uh-huh.
maybe they need some supplements, maybe they need some omegas and some other things to help them out.
Yeah.
But an animal who's thriving is going to be walking around in patent leather shoes with a nice shiny nose,
Mm.
no dryness, no dandruff, no itching, no goop in the ears. They're going to be active, bright, happy.
Okay, that's good to know. I'll check these guys in a bit, like, because I don't really look at. I have to make sure that all the nose are shiny and everything.
I'm just so excited to talk to you, and I have all these questions. So, allergies are the bane of my existence. I feel like 70% of my appointments are ear infections, itching, skin infections. And, unfortunately, I'm not trained as a holistic vet. And so, a lot of times it's like, of course, you want to take care of the skin infections, but we have the long conversation about diet trials and environmental allergies and the shampoos and all of this. So, what is your advice for dogs, especially that are dealing with allergies, as far as on the holistic side?
So 90% of clearing up allergies is clearing up gut issues.
Mm.
So they may have normal stool and you may think that they don't have gut issues, but believe me, they have leaky gut. So the
Mhm.
first thing that I would do, first, we've got to get their diet right. So they've got to get off the highly processed food. It's just like us. It's just like, your son having the breakout and you cleaned up the diet and said, we're doing gluten free and dye free and blah, blah, blah. We need to do the same thing with our pets. We need to get rid of all the synthetics in the diets. We need to get rid of the highly processed, highly cooked food. So we want to go to fresh food. And what I found, so in all of my rescue work, we've brought in a lot of dogs with bad skin, bad ears, bad eyes, bad, icky, stinky, everything. And so the first thing I would do is take them off any processed food and put them on. At the time, I was using homemade diets, but now there are so many companies that make beautiful fresh food diets that don't have a lot of starchy carbs. So you got to get the starches out because starches break
Mm.
down to sugars, and that's just feeding the yeast and feeding the bacteria. So you got to get rid of that. And then we got to fix the gut. So these guys, usually, if they've had allergies and all these problems, they've been on rounds of steroids or Cytopoint or antibiotics. And all we've done is just destroy the microbiome over and over and over and over. So I'm going to mention a company, but Adored Beast has a leaky gut protocol that is
Mm.
just amazing. So I do that first because we could just start with throwing probiotics at them. Well, we
Mhm.
have to clean up the diet because if you
Mhm.
can't out supplement a bad diet. So we clean up the
Mhm.
diet and maybe you look for a novel protein. Maybe we look for a gently cooked rabbit diet or whatever they haven't had a lot of. Pork generally will work pretty well as well. We used to use lamb all the time, but now lamb is in so many foods that some
Yeah.
pets are allergic to it. But
Right.
again, if we go to a fresh food lamb, not a highly processed lamb, they'll probably do better. So then we do a leaky gut protocol, and then I will follow that with FMT, which is fecal microbiota transplant. And the one that I really like is Legacy Biome. It's a much cleaner transplant and it's capsules. So your pet owners can do this. Like the leaky gut protocol is here, give them these drops, put this powder in the food. Okay, we've gone through that. Now we're going to do a fecal microbiota transplant. And it's a capsule. So here, give them this capsule once a day. You just put it in the food and they eat it. It's fine. Easy to do. Dogs love to eat poop anyway. But this is
Very true.
dehydrated, so there's nothing disgusting about it. That will replace what we've been destroying over and
Oh,
over again. And then once we go through that, so it'll take a few months, but once we go through that protocol, I would say 90% of the symptoms go away.
oh,
Wow.
Like one of my friends, she has a Cavalier who she's been feeding her a fresh food diet. She makes her own, one of my recipes all the time. And this one dog has just had yeasty ears over and over and over. And I just can't make them go away. And
mm,
so she was getting the ears packed with, the long lasting antibiotic stuff. And she's like, I
mhm.
just don't feel good about this. I know I'm killing off the
Yeah,
microbiome in the
yeah.
ears. And so she went through this protocol and the ears are beautiful now.
Oh, that's amazing.
Wow.
She said, "I cannot believe I waited this long to do this, and now I'm not fighting my dog with the ears anymore."
Mm,
So, I will say 90% of them will clear up, and frankly, in my practice, when I started giving people recipes to solve problems, we weren't even having to go all the way through the leaky gut. I was just cleaning up their diet and putting them on some good probiotics and poof, problem solved. So, that's what I love about food therapy. It
mhm.
makes you look like a hero 90% of the time. Like all you
Right.
did was get them off the synthetics and the additives
Yeah.
and it's like kids who have AD. When my kids were in private school, there was this one mom, this little boy in the class. He was so disruptive and such a
Mm,
problem. And suddenly he was no longer a problem. He wasn't acting out. He wasn't being the class clown. Like all of a
mhm.
sudden he was learning and his grades were good. And I met the mom in the parking lot. I said, "What did you do?" And she said, "I discovered that red dye makes my son a crazed maniac." And she cleaned up the diet and got rid of all the ultra processed stuff, not allowed to have, hot dogs and Doritos and everything with dyes in it. And the kid did
Mhm.
a 180.
So what?
So we see this same thing with our pets. If we
Yeah.
change up their food and it's like, I look like a genius. This is
Mm.
great. Yep.
Yeah.
Pat myself on the back and I'll take credit for that. But it really,
Yeah, yeah. Well,
uh,
you're a forerunner.
and the other thing that you can do with your really difficult cases. So I had one, this big German Shepherd belonged to the local ophthalmologist. And he had been to the university and they had done allergy shots and testing and Apoquel, and he had spent
Mhm.
thousands and thousands of dollars and the dog was still miserable. And so he came to me and I said, "Yeah, I can take care of this." And I said, "I'm going to put your dog on a raw goat milk diet for 30 days. That's all your dog's going to eat." And unfortunately, goat milk is only 30 calories per ounce and it was a 130-pound dog.
Oh,
I'm
it's
like,
100.
I don't think your dog can drink this much goat milk
Yes,
in a day. This is like
right?
gallons and gallons.
Wow.
So
Yeah.
we ended up making a protocol where we actually utilized some raw cow milk
Mm,
because it's twice as much fat
yeah.
along with the raw goat milk, very well sourced. We were up in Pennsylvania, so near Amish areas where they could
Mhm.
get all of this. He did it for 30 days and that dog was
Change.
gorgeous. And we didn't do anything else.
That's
No drugs,
amazing.
nothing else.
Wow.
Just the raw milk diet for 30 days and that dog was so great. And he came back to me and he says, guy was a nut. He says, "Well, he still itches occasionally." I'm like, Your
That's
dog has a
smart.
beautiful coat. It doesn't have hot spots. It doesn't have sores on its feet. It doesn't have infected ears. And you want to complain that your dog scratches occasionally. It's being a normal dog.
Yeah.
So,
Right.
and he ended up
This is
going back
normal.
to
Yeah.
he ended up going back to a traditional practice and blew the whole thing by going back
Oh
to
my
doing
gosh. They
everything
could see
wrong.
that.
And I'm like,
Oh,
"Ugh."
no.
But
Yeah.
it was proof. So with smaller breeds of dogs, it's like, yeah, we're going to do the raw milk diet, and I mean that would be easy for me now. I have my own dairy cow, so we're going to do the raw milk diet for 30 days. And raw goat milk is made by so many pet food companies now. It's so
Yeah.
easy to get a hold of.
Yeah.
So for small breed dogs, if you have clients who are willing to do that for 30 days, you got to take them off all the medications and the chemicals and everything
Yeah.
else. Get all that out of their system. You'll be amazed.
There you go, Dr. Amber.
Wow.
Oh, maybe I'm gonna do that for my Martin too, because he's allergic to a lot of stuff.
It's just fixing the gut.
Yeah.
Yeah.
So, Dr. Judy, do you do because I think I might maybe later, like I have a consult with you for a tuxedo.
So I do very few these days because I have so many irons in the fire.
Yeah.
But we do have a list of about a dozen holistic veterinarians
In
that
the
we refer to.
okay,
So
and
if you email us and say, "Hey, can I get a consultation?"
mhm.
Usually the first thing we'll say is, "Okay, what are the issues that the pet is having?"
Yeah.
They're gonna have a lot more fun with this than I am. I mean, I can do it, but they really enjoy it. So, a lot of times, especially if I'm busy, we'll refer to them. So it kind of depends on what the case is. Sometimes we'll say, we think this particular doctor or one of these particular doctors. Other times we're like, oh, any of our doctors could handle that. Here's a list, pick one.
Okay, awesome. I'll email you guys because like talking to you now, and I'm like freaking in my brain's just like, oh my god, I don't want to feed him. And then at the same time, like he had like 2 bladder stone surgery over the last 4 years, so that's something that I wanted to. I mean, he's drinking water now, but still, I really wanna get the natural side of how I can help him.
He would be happier.
Yeah,
They always like real food better.
yeah. True. Okay, I feed them like for treats like fruits, all those stuff that not every day, but those are the things that I try to like get them on instead of the regular treats that you buy online or in stores. And I give them like organic coconut water if he needs to drink
Cool.
water, and he loves it. So sometimes I make broth for them.
Good.
Yeah, yeah.
Dr. Judy, before we wrap up, what is one tip that every pet parent should know if they want their pets to live the longest, healthiest lives possible?
Fresh food.
There you
Feed
go.
real food, get
Yeah,
rid of ultra processed food. I mean, we're hearing this for people as well. We
yeah,
need to get
yeah.
rid of ultra processed food. We don't want our pets to be obese. We don't want our pets to have chronic disease, chronic
Mhm.
inflammation in their body. And the best way to do that is with fresh food. And there are, like I said, there's so many good companies out there now that are making really high quality. And if you're afraid of raw, that's fine. We've got a bunch of companies that make gently cooked that
Oh,
is just
I heard.
amazing. And nothing against veterinarians, Dr. Amber, but my goal is to keep these animals healthy so that people aren't there every single month because, it's really frustrating for the veterinarian to have, like you said, these allergies and skin infections and ear infections, and they're just coming back and back and back.
Yep.
It's frustrating for the vet because it's frustrating for the parent. It's
Mhm.
painful for the pet. And
Yes.
everybody's just wringing their hands like, I just want him to get better, and it's
Yeah,
not working. And
Yeah.
fresh food is the answer.
exactly. And the stress that you feel, like the animals mirrors us too. Like,
Exactly, exactly.
yeah. Tell me about it. Like tomorrow he's got his vet appointment tomorrow for his Addison's because he was diagnosed with Addison's last year, and we have to go through like a whole year of tests, and I get nervous going there. So that's something that I have to.
Don't blame you.
Yeah, I'm gonna email you later. Anyway, and for I know, and for the listeners who want to dive deeper into your books or your programs, where can they go, Dr. Judy?
Naturallyhealthypets.com is our website. We are on all social media as Dr. Judy Morgan's Naturally Healthy Pets. And don't forget the code VitalPet50 for 50% off my books on our website. So tons of information there. But we also just have tons of free downloads, tons of free information. Again, our goal is to empower pet parents to make good decisions, ask good questions, keep your pets with you as long as possible.
My takeaway for this conversation is like fresh food, whole foods, the food therapy. Like I like that. What about you, Dr. Amber?
My takeaway is that I want to try to learn more about this. I've always been kind of like, I would say crunchy, but like you're trained a certain way in vet school and it's really hard to get out of that. So, Dr. Judy, do you mentor vets that want to be holistic, or do you have some
I
Maybe we
uh,
should
do.
have a
you know,
university for Dr. Judy and all the
wait,
vets.
can
We
you
have
be my mentor?
we actually have Dr. Judy U, and there's about 40 courses on there. My hospice and palliative care course is actually a certification course if people want it. And then at our big event, the next one is April of 27 in Dallas, Texas. We will have 6 international speakers there
Mm.
and CE credits available. And Dr. Amber, I would say you should join and go to the AHVMA conference, which I'll be speaking at this year in October in San Diego. But
Oh,
AHVMA is the Holistic Veterinary Association. And
Okay.
I mean, I've had a lot of young veterinarians and veterinary students that reach out to me. I've had some that come spend a day or two with us and just, I'm not in practice, but I'll talk holistic medicine all day long. And a lot of them, one, I just convinced her to get out of traditional practice and start her own
oh,
holistic
that's
practice. So,
amazing.
yeah, really excited for her. She emails me a few times a week. And, she's like, I've got this case and I did this and I did this. Am I going the right way? I'm more than happy to help my fellow veterinarians because I want more veterinarians to move
Yeah, I was
into the
just saying.
holistic space. So,
Yeah.
I want integrated medicine is so much more powerful. You just have a million
Yeah.
more things in your toolbox. So why not
Yeah.
use them?
How can we like I wish that we can change that and put that into the whole school system we're in it's more
But we'd love to.
that's the goal.
I have offered to speak at a lot of the vet schools, and so has Karen Becker. Sometimes she gets a
Yeah.
foot in the door. I'm not having great luck, but the AHVMA is trying to get more student holistic associations at the veterinary colleges.
Mhm.
And I actually told one of their admin people when I saw her at a conference recently that I would be willing on my own dime to go to every single vet school and talk to the student holistic clubs if they can get them up and running.
Oh,
Well,
wow.
wow, that's amazing. Maybe we can
That's
find a
amazing.
way. Maybe
We're working
all
on it. We're trying.
yeah.
I'm trying to get them to be a little more active in pushing for students. And for our event, we offer student scholarships so that we can get more students to start working on this early.
That's amazing. Well, thank you so much, Dr. Judy, for sharing your wisdom and helping us unleash curiosity for the benefit of our pets.
No problem. Thanks for the opportunity.
Yeah.
Yeah, thank you so much. And how can our listeners follow you or reach you?
The best way, if you have questions for us, follow us on social media. We have a lot of interactive stuff going on our social media. We do have people who monitor the social media and answer questions. We
Mm-hmm.
do have a private group on Patreon, and
Oh.
on that, I do Ask Me Anything. So we'll
Mm,
spend an hour where people can type in their questions, and I sit there and rapid fire answer questions. That's kind of fun.
Very
And
cool.
and on that Patreon group, they also get a monthly discount. They get a new recipe every month. There's just
that's
all kinds of
cool.
fun going on. So, and you can email us through the website if you have specific, questions, issues, stuff that you have going on.
Amazing. Well, thank you again, Dr. Judy. You will definitely hear from me.
Yeah. Thank you so much. This was amazing.
Yeah. And then I love
Very inspiring.
I know, and the more I'm inspired to help vets. Like this has always been my thing with Dr. Amber. Like there has to be a way that we can help vets to be more proactive and teach us. Like I'm always curious, and to be honest, I feel like there's a lot of pet parents out there that are now open to
Oh, yeah,
holistic or integrative vet or practices for their animals, especially the
absolutely.
younger generation. I feel
Mhm.
like they're more open.
Yep.
Yeah. All right.
They shop at Trader Joe's and Whole Foods and Sprouts, and they want that for their pets as well.
I know.
Yeah.
I'm
Thank
really
you.
grateful to meet you. And again, I'm gonna message you To our listeners, if you love this episode, subscribe, leave a review, and share it with a friend who loves their pets. And remember, longevity isn't just about years. It's all about living those years healthfully and happily.
You can email us at podcast@vitalpetlife.com or tag @vitalpetlife on social media. We'd love to share your insights with our listeners and viewers in a future episode. Until next time, stay curious. We'll see you next time on Unleashed Curiosity, where we continue exploring the science, stories, and secrets that help our furry family members thrive.